We're back here on Carolina Women with our friend Sheree Tuttle. We're here at Bluffton Aesthetics. And you know, we had a segment where we really talked about non-invasive body contouring and sculpting. And we decided, as we all kept asking questions and people wanted to know more and more, we thought it might be interesting to do a little bit of a deeper dive into exactly how we do this and why it works. And one of the things that you shared that I think our audience will find interesting is how technology has changed and improved.
Yeah, it is improved quite a bit. Like I said, some of the older devices, you know, didn't do the skin tightening. Yeah. So a lot of patients weren't a candidate because they would lose the fat and then have that excess skin.
Oh, I never thought about that.
They didn't want to have the surgery. They didn't want to do that. So they wouldn't be classified as a good candidate because of the excess skin. They're going to hate more than the fat.
Right.
So, you know, the newer technology, especially the TrueSculpt ID, has radio frequency that tightens the skin. So you don't have as much of an issue with that excess skin after getting rid of the fat.
So again, that is a radio frequency?
Correct.
All right, talk to us a little bit about that.
So both devices have radio frequency.
Okay.
So radio frequency, you know, tightens the skin. It creates that thermal heating.
Okay.
And so where the other devices basically just get rid of the fat, you know, so whatever skin's left, and you can do other devices, but a lot of people don't want to do multiple things. They want to want to stick to the same thing.
I want one-stop shop. I want to know it works. I want to know who's doing it for me.
And some of the older devices too are not necessarily good on mature women either. So the technology, the improvement of the technology is allowing pretty much any age demographic to be able to get results and do these treatments.
And so what does that actually look like? What would a client come in? What is the procedure, I guess is really what I'm asking.
So yeah, so the Emsculpt Neo, this one here, you can see there's two paddles.
Okay.
So basically the patient would lay on the bed, I'm doing their abdomen, and either one or two paddles would go on the abdomen, and it goes through 3 cycles. So, and actually you don't really get that soreness, you get a fatigueness with it, but it doesn't get sore because it's going through the stretching, the massaging, and the contracting. Okay. So you don't leave with like, oh, I can't sit up, you know?
So it's not
it's intense. So you're getting basically a vigorous 10-week workout in 6 weeks.
Oh, well, when you say it like that, that's kind of, that makes sense.
And there's literally no downtime. You go to the gym, like you don't stop your routine, nothing stops. There's no downtime, as a lot of people do not like that social downtime, no bruising, no swelling. So, and the ID is a 15-minute treatment. It feels very warm. Okay. So it gets really warm. And you know, it's 15 minutes, you're done. And it looks a little pink for an hour, and that's it.
And that's it. How long are these treatments?
So these are 30-minute treatments once a week for 6 weeks.
Okay, 30-minute, okay.
Because we're doing muscle. This one you can do abs, glutes, calves, and triceps and biceps.
Okay, let's review that. Abs, glutes, triceps,
biceps, and calves.
Okay, and what do are men looking for something different than women?
Yeah, most men are abs and flanks. Okay. You know, women, I do a lot of arms on women because they're pickleball and tennis and the sports, you know, women lose their upper body strength. So we have the combo package. It's really more beneficial to do triceps and biceps on women at the same time for the better build of muscle and strength. So we have combo packages to save money, and they can do them both together. So that would be an hour treatment, 30 tricep, 30 biceps. And then, but yeah, men don't like the flanks and the abs. So they're number one.
Is it different for different age groups too? What are no, not at all.
Yeah.
What are the younger? Are the girls just, especially after having
the pooches,
babies? Yeah, I would think that would be great.
No, and it's really a lot of these devices are more foolproof than the other one. I'm certified in some of the other devices, and they're very labor intensive. Where these are kind of, I love the ID because it allows you to monitor their temperature and the device temperature, so you're getting to that sweet spot easily.
Yeah, exactly. Yeah. Oh, that makes so much sense. It's always really fun to talk to you, and I like doing the deeper dive because it really helps explain what I'm getting into before I do it. And I like the list of how long it's going to take. Sheree, you're great.
Thank you.
Lots of good information. Stay with us, more to come on Carolina Women.